So, medical conditions related to baby that would be indications for an induction would be if there was a size that were to the extreme. So, a baby that is measuring small for gestational age, and or a baby who's measuring large for gestational age. Now, with this is where rapport and relationships with out of hospital sonographers and maternal fetal medicines are very critical, very important. I myself have a maternal fetal medicine doctor that I utilize that I have delivered babies or babies have delivered, and their estimated weight that he measured was off by a couple of ounces. So whenever that maternal fetal medicine doctor states a weight for a baby, I trust that more than some providers may trust their other sonographers, because sometimes they overestimate or underestimate. So again, relationships are important in out of hospital care. But for a baby who is small for gestational age, many people will feel like it's counterintuitive. So if my baby is measuring small, wouldn't it be wiser to just let them stay in longer and grow so that they can get bigger and get to a size that is, healthy? Yes, in theory, that would be what, we will all be thinking. However, when it comes to the physiology of pregnancy and the growth of a fetus inside of a uterus, usually when babies are measuring small for gestational age, there is some type of blockage and or some type of disorder and or something that is preventing that baby from getting all the nutrients they need to get in order for them to be an adequate size. Again, in my care, there are times where babies were measured small, but with counseling of diet and nutrition, those babies caught up, and then we didn't have to do an induction. In the case of a large for gestational age baby, those are usually your babies that, they're estimating they're going to be 8, 9, 10 pounds at birth. And again, like I said, that's where relationships are key, because if you have a sonographer that overestimate and then you go to deliver and that baby's only 7 pounds, but you did an induction because they thought a baby was going to be 9, that happens a lot. However, midwives, we are very astute in our measurements as far as doing fundal heights, as well